Hello and welcome to our eHealth 724 video presentation. I'm Megan and I will be your guide. Today we will explore hospital bed management. More importantly, we will examine how the implementation of an electronic, real-time, hospital-wide bed management system has the potential to improve communication, throughput, and patient and family experience in an Ontario hospital. To start off, let's understand what patient flow and bed management means. Patient flow is the transition of a patient through the continuum of care within a hospital, from the emergency department to an inpatient unit and back to the community. You may be wondering how patient flow is related to bed management. The core of patient flow is efficient bed management. Bed management is the allocation and provision of beds in the various units of a hospital. The bed in this context represents more than a place for the patient to sleep. The bed also requires the planning of associated services and clinical requirements for the patient during their hospital stay. Bed management tasks are usually done using a bed board. A bed board can be an electronic or a non-electronic system. It can be automated during the electronic phase or updated manually in a non-electronic situation. Bedboards display all of the rooms within a hospital and the patients within each room. A typical bedboard looks like this. Keeping a unit's large white dry erase board up to date 24/7 takes a village. The whiteboard, found on every inpatient unit, is the main communication tool used to display patient bed assignments. On the board is information such as beds, attending physicians, nurses, contact information, and clinical information about the patient. A patient's clinical status can change at any point, and so must the board. Now that you know more about bed management, let's take a look at the day in the life of a bedboard coordinator. Meet Sandra, a bedboard coordinator here at Charming Hospital. Her job is to ensure that when a patient is admitted to a hospital, there is a bed available for them. Patients have unique needs when it comes to bed assignment. For example, a patient may need a private bed with a dialysis machine present in the room. It is a huge responsibility. Without the right bed type, a patient cannot be admitted. However, finding beds for the right patient at the right time with the right level of care and services attached to it is a challenging task. Typically, most hospitals keep more than 95% of their beds occupied. It simply doesn't make sense to let them be empty and unused. Sandra has a stressful job, as efficient patient flow is vital to hospital operations. Sandra assigns beds and reassigns beds to move patients into the right level of care, using paper ledgers, whiteboards, spreadsheets, and many phone calls between the different clinical and administrative departments. Sandra believes that there is a more efficient way of completing her daily work with an electronic bed management system, or EBMS for short. Sandra wants to convince her boss, George, and the other hospital staff members of how this will help achieve better patient care by coordinating the capacity of these finite bed resources more efficiently. Sandra begins her research. However, most of the literature available to Sandra is biased, written by the software vendors and hospitals who use these systems. There is little information in peer-reviewed journals and a scarce amount that focus on the evaluation of an EBMS within the context of an Ontario hospital. There are a variety of bed management software vendors in the marketplace, such as MedWorks and Versus. These systems can be purchased to stand alone, or they may be integrated with other hospital information systems. Charming Hospital wishes to increase transparency across the fragmented and siloed stakeholders. Using an EBMS will enable active information sharing to improve communication. Features like dynamic dashboards can be used to automate changes in patient bed status. These systems also use predictive analytics to forecast and manage both the demand and capacity for inpatient beds. Automated messaging will also prevent overcrowding and bed hiding by providing up-to-the-minute information to hospital staff. Everyone in Charming Hospital will know what is happening with a patient from the moment their status changes from the unit nurse to the housekeeping staff. Most of the systems available incorporate technologies like radio frequency identification, or RFID for short, to streamline various hospital services such as housekeeping and portering. Sandra is convinced that incorporating RFID technology with an electronic bed management system can bring much more to Charming Hospital. She envisions things that haven't been done yet before. RFID technology can track patients as they move throughout the hospital. Data from these trackers are useful for calculating wait times and tracing infectious disease incidents. There is also the possibility to share the patient's journey with their family using this tracking information. Furthermore, RFID information can support the development of discharge summaries and have the potential to improve hospital-to-community transitions with more timely access to information for primary care follow-up. Improvements in hospital-to-community transitions could involve bridging the Internet of Things. Data from telemetry devices can be fed back to clinical and hospital information systems to improve patient care. This information can be used for predictive analytics to build indices to assist primary care providers with identifying high-risk patients for prioritization of community services. Knowing that ethical and evidence-based decision-making is part of the corporate culture at Charming Hospital, Sandra begins to discuss successful implementation factors with her boss, George. First and foremost, a change management strategy needs to be in place to ensure successful implementation and adoption of an electronic bed management system. To gain user buy-in, studies suggest that it is important to engage clinical and administrative staff in the design of a customized solution to meet Charming Hospital's needs. The new system must be cost-efficient, include a robust training program, and provide 24/7 technical support. For ethical reasons, when choosing an electronic bed management solution, the vendor selection process should be transparent, and the protection of privacy and maintenance of confidentiality should be a top priority. Data collection and reporting must be reliable, and performance reporting metrics should be carefully selected. Sandra has convinced George and other hospital staff members that an electronic bed management system has the potential to dramatically improve the effectiveness and efficiency of hospital service, thereby enhancing the hospital's throughput. Patient wait times, bed capacity, and occupancy rates are universal hospital reporting statistics that are compared by the Organization for Economic Cooperation and Development, or OECD for short. Hospitals around the world in Europe and Australia, as well as the United States, have indicated that electronic bed management solutions have contributed to a standardized placement process, improving their patient flow. George and Sandra begin to explore what other hospitals in Ontario have been doing with electronic bed management systems. They find that hospitals with bed management software have reduced their alternate level of care bed occupancies to less than half and improved the discharge process, resulting in a better patient flow for their organizations. St. Michael's Hospital in Toronto and South Lake Regional Health Centre in Newmarket are using an EBMS by the vendor MedWorks. A more widespread use of EBMS may increase Canada's OECD healthcare ranking, which is now in the bottom third with 2.7 beds per capita. It may also decrease the bed occupancy rate, which is the fourth highest among member countries. Patient and family satisfaction could also be improved by providing a customer service experience to rival the best hotels. Using data captured from their new system, Charming Hospital may create a patient-facing dashboard. This external website will allow the community to view the types of rooms available. It can also provide up-to-the-moment tracking information for a patient's family to check in on their loved one during their hospital stay. Using dashboards to communicate wait times in the emergency department and other primary healthcare locations, such as urgent care centers, can help patients in the community plan their visits for minor but frequent complaints such as influenza. By reviewing all of the supporting evidence, Sandra and George are convinced that the implementation of an electronic, real-time, hospital-wide bed management system at Charming Hospital here in Ontario could result in dramatic improvements in throughput, communication, and patient-family experience. To them, better quality of care for the patient is a more efficient hospital and a healthier Ontario.